Hey guys, here we are doing some tox on this patient. As you can see, we're really focusing up on that upper face. So I marked the patient's frontalis already. I marked those lateral borders of the frontalis, and then I spaced my injection sites out across the whole entirety of that frontalis. When I'm injecting, I'm typically always injecting up towards the hairline. My needle depth is about half needle depth, and I'm working in a fashion that makes sense to me, so I'm confident while injecting. As you can see, I changed sides of the patient just so I'm more comfortable. I have most control over my needle, which is very important. And overall, we are giving the patient the appropriate dose all the way across that frontalis. So make sure you're always treating from one lateral border to the other lateral border, just to prevent any spocking of those eyebrows and always to ensure that your patient is getting full coverage of toxin in that frontalis region. Highly recommend bringing your patient back for a 2-week enhancement just in case they need it, just to reassess if that dose is appropriate for them or if you need to work on tailoring a better dose for them. Next, we're doing the glabella complex. As you can see, I marked up a 5-point injection for this patient. I typically have my patient animate and make an angry face for this. I'm marking those lateral tails of those corrugators, and then I'm injecting the procerus and medial corrugator on each side. It's very important when you're injecting this medial corrugator that you're really watching your depth. So your depth here should be a true 3/4 depth, isolating that muscle. And then when you move to the lateral tail of that corrugator, it should be a true half needle depth because that frontalis lays underneath that lateral corrugator. Here we are moving on to the crow's feet. As you can see, I had my patient smile really big. She doesn't really have a lot of crow's feet, so we're really just doing a baby dose in this area and really isolating those really fine lines. I usually stand on the opposite side of my patient just because it allows me to inject always up and away from their eye to maintain safety of your patient. I try to never inject towards the eye. That's just a little tip and trick from me. But make sure that you are making sure your patient is safe first. If they flinch, you might have an accident. That's going to be no good.